third table down. What was that? Well, I am wigged out by that one that is sparking. The pacemakers that we got were post-mortem, so they came from people that had already passed. And we were immediately faced with a biohazard condition of how do we remove the bloodborne pathogens from these pacemakers and other implantable devices to make it safe for our lab team to figure out how to get these devices apart and understand what data may be inside. This is the first stage of the cleaning process, and we'll go to a second stage cleaning process so that we can start to interrogate the devices. We were in the final stages of defining our decontamination process for bloodborne pathogens and other kinds of hazardous conditions that the device may be exposed to. This provided a perfect platform for us to take these pacemakers and implantable devices and put them through our decontamination process to remove the dangerous bloodborne pathogens. It was one of the implantable devices that has been out of a person for multiple days or weeks at this point, and it still is intermittently has an alarm sounding. We didn't know that these things made sounds. Probably the biggest challenge for us in digital forensics is there's nobody else to call. There's no other company that we can call that has done this before. There's not training that you can go to. There's not books on this particular topic. So we're really figuring it out as we go in this new technology area. The pacemakers have proven to be a tremendous challenge. And probably the very first challenge that we started to think through is that they come in a titanium case that is welded at the factory. I was trying to expose the screw. But I've never seen anything like this, so I don't know how to open it. We didn't know how to take them apart. We had to figure it out. And we looked at multiple techniques of how to open the titanium case. One of the challenges that we came into, we would x-ray the device and we would see that there's very, very tight tolerances inside of the device. So we didn't have much room for error. We're gonna have to cut into this case, so I wanted to see how much space there was around it to cut. I can see a space to cut around this perimeter, and I can also see a space to cut here. This is the part that's most confusing because it looks something is running right up against the edge of the outside edge of the device. The success we finally ended up having was with diamond and carbide tipped blades that allowed us to cut just around the perimeter where the weld is on the device, and then separated into two halves so we could get to the circuit board inside.